All right, what's up everybody? Jared here again, week 2. I just want to give you a couple words of advice and some things that I noticed from week 1. Number 1 is when you're referring to the athletic training profession, I want to make sure that we're saying athletic trainers and not trainers. I wrote a note to a couple of you guys. We're trying to distinguish, don't mind this foot by the way, we're going to get to that. I want to make sure that we're distinguishing our profession from like personal trainers, horse trainers, anybody else that's a trainer of some sort. So our profession is really making a push to call everyone athletic trainer rather than just trainers. The other thing is when we're doing these discussions, so you're supposed to post a discussion and then respond to 2 other people's, make sure that you post this discussion by Thursday night so that everybody has the opportunity to respond to your discussion. If you're waiting to post your discussion until Sunday night at 10 p.m., then it's really hard for other people to respond to that. So make sure you do that. I've been pretty lenient on grading this week, but as the weeks go on, as the information gets a little more intense, be a little more intense on that as well. And then also, some of you did this, but make sure that you're using some outside sources when you're talking about your assignment or your discussions. I really like to not just focus on that Prentice book. It's a good book, but I really want us to focus on what's some current literature. So look at some peer review journals and some things like that, and make sure that you're using relevant information. All right, so moving on, I didn't want to make this video very long, but I just wanted to show you some things we read in the book, and this week especially we're talking about the ankle joint. I wanted to show you a couple different things that I think are important, and then show you some applications. Since it's an online course, you don't really get to see this. The first thing is the different arches of the foot. They talk about, a lot of times in the arch, we're just referring to the medial longitudinal arch, which is on this side. You can't actually, here, flip the foot around right here. You can't actually see this arch, but we're talking about medial longitudinal arch. So let me see this other foot. So right here is the arch that we think about the arch of the foot. That's what we're thinking about. But there are also other arches that run here along the foot. So we have one on the outside. We have one that runs along the head of the metatarsals, and we have one back here in the posterior portion of the foot as well. So I didn't know if you had ever heard that before, but I want you to be familiar with that, and the specific names to those arches are in the PowerPoint. The other thing that the PowerPoint mentions briefly that I think is really important, I do some strength conditioning as well, and golf fitness, and so one of the things I really focus on is the kinetic chain and how injury at one joint can relate to injuries at other joints. And if we think about the ankle joint, this is really where it starts for a lot of people. Now, movement needs to start from the hips, but the ankle joint should be a good joint that allows us a lot of mobility, but we don't want too much mobility when we rupture ligaments. I don't know if anyone follows golf or sports, current sports, but Rory McIlroy just ruptured a ligament. I'll talk about that in just a second. I'll show you the ligament in just a second. But we don't want that much mobility. We do want mobility, but we don't want to rupture ligaments and things. So I want you to understand that if there's an injury here, this is where a lot of our movement starts from. If you're unable to bear full weight on your ankle, it's going to affect your knee, it's going to affect your hip, it's going to affect your core, it's going to affect your shoulder, all the way up. So that's important to think about. The other thing is the PowerPoint talks about the gait cycle. When we're looking at the foot, one of the most important things that you can do is learn how to look at how the foot lays out when you weight bear. So we're looking at a heel strike to a toe off, and then that chart's in the PowerPoint. But we want to strike the heel and then push off through the toes, and that really allows you to see if somebody does have some problems or some issues with their feet or their ankles when we watch them walk. And you really start to analyze that gait cycle. So make sure you look at that chart. That's really important to what you do. If you guys have any more questions about that, you can contact me directly and I can walk you through some more of that. What I wanted to do to end this video is just to show you some special tests, all right? So this is what I do as an athletic trainer. An athlete comes to me, says, I've injured my ankle. We go around, we do palpations, and then we actually do some special testing, which really just shows us the evidence of a fracture or ligament injury in the ankle. So I'm going to show you a couple of those. First thing I want to do, give me another foot. First thing I'm going to do is just show you some bony landmarks, so anatomical landmarks. So the first thing I'm going to do, if my athlete comes into me and says, you know, I'm having some pain in my lower leg, my ankle, my foot, I want to do some palpations. I just want to show you guys the basic palpations that we're talking about and make sure that you understand where these reference points are. So in the lower leg, we have the tibia, which is a shin bone, and then I have the fibula, which is a long bone on the outside. These little circular notches on the outside and on the inside of your ankle, these are part of those 2 bones. So as the fibula comes down on the lateral or outside portion of the leg, This is the lateral malleolus. All right, that's what we call that. So you'll see that in the PowerPoint. Lateral malleolus. This is the lateral malleolus. It is the most distal portion, distal meaning away from the body, away from the torso. This is the most distal portion of that fibula. All right, lateral malleolus. As we work around, we're talking about some of our ligaments here, and I'll show you a test to test these ligaments. Our anterior talofibular ligament is the ATFL. That's the one Rory McIlroy ruptured. That's the most common as I invert. So this motion is called inversion. As I invert my ankle, that's going to be one of the first ligaments that's going to have some damage to it or stretch out. All right, the second one is the calcaneofibular ligament. Now these ligaments obviously are named for the bones that they attach to. So ligament attaches bone to bone. So anterior talofibular attaches the talus to the fibula, calcaneofibular attaches the calcaneus to the fibula, and posterior talofibular does the same thing posteriorly. All right. On the inside, we're just going to refer to, on the medial portion of the ankle, we're just going to refer to these as the deltoid ligament. All right. There's different ligaments in here that attach to different bones, but for the purpose of this, we're just going to call this the deltoid ligament. This most distal portion of the tibia then is called the medial malleolus. All right, and that's where the deltoid ligamentous group attaches there. All right, as you palpate down, we want to palpate the calcaneus, which is obviously the heel bone. You can get the Achilles tendon back here. You're going to palpate in here. Obviously, if we're looking for pain in the medial longitudinal arch, then you can go down through each of the metatarsals one at a time, and we'll get into the foot. But really, for the purpose of the ankle, know where the ligaments are, know where the medial and lateral malleolus are, and that'll give you a good start. All right, some of the tests that I want to show. I'm just going to go over the tests that are in the PowerPoint. First test is to check for the presence of a fracture in the lower leg of the ankle. It's just a compression test. All I'm going to do is I'm going to take my hands kind of like this behind the posterior portion of the leg, and I'm going to squeeze with the palms of my hands. All right. So I would actually stand up and do this here. Squeeze, squeeze, squeeze. You're looking for pain or looking for any discomfort or obvious deformity. All right. The second test is just a bump test. So the way I'll do this is I'm really just trying to generate a force up the calcaneus, up through the tibia and the fibula, and see if they have any pain with that. If those tests are positive, which would be pain, that would indicate possible fracture. All right. The Thompson test is a test for the Achilles tendon. All right. Usually, if you have an Achilles tendon rupture, you're going to know it. Really, all we're doing with the Thompson test, and I would usually have them lay prone on the table, all right, which would be on their stomach and have their leg hang off. You can also do it like this. So what I'm looking for right here, you can see the toes point down or plantar flex. As I squeeze the Achilles tendon, this is a negative Thompson test. If someone has ruptured their Achilles tendon, this toe will not move, all right? So that would be a positive Thompson test for Achilles rupture. All right, one of the main tests, let me see your other foot. One of the main tests for ankle stability is called the anterior drawer test. And really what I'm going to do here is I'm just trying to translate the talus bone forward. So if I've ruptured this anterior talofibular ligament, that's going to be loose. So what I'm going to do is I want to draw that forward so you can see how that bone slides there. And this ankle is really stable. So what I'm going to do always is compare to the other ankle, so the good ankle. So if he's injured this ankle, I want to go to the other ankle and see if I've got any discrepancies. All right, the other one that I would always do with an ankle sprain is called Taylor tilt, and I showed you inversion. Really all you're doing with some of these special tests is recreating the injury. Taylor tilt test is just like this. I'm going to stabilize the lower leg, and I'm going to invert his ankle this way. Now, if this ligament or any of these ligaments over here are ruptured, you will see this kind of give way a little more, so you can see this ankle stop. Like when I invert that ankle, it stops. If you have a ligament sprain, it's going to have more laxity or give to it. And so that would be a positive Taylor tilt test. Last test I'll show you is called a Kliger's test. Really all it is an eversion. So we're going the opposite way. We're testing the, let me see your other thing. We're testing the integrity of the deltoid ligament. So pushing this way. If this ligament is torn or ruptured, then that will give more on this side than it will on the other side. Another thing you can look for here is, sorry, switch legs one last time, is a Kliger test. I can evert and then I can dorsiflex the ankle. So dorsiflexion is this, plantar flexion is toes down. I have a ligament up here, my anterior tibiofibular ligament. So this connects the tibia to the fibula. This is what we refer to as a high ankle sprain. So if I dorsiflex here, this ankle is going to open up this space where that anterior tibiofibular ligament is, and that will cause him pain. So that would be a positive Kliger test. That's all I wanted to cover. I don't want to make a half-hour video, but just wanted to show you guys some of the tests and then encourage you to keep working on those assignments and those discussions. I'm reading those. I'm enjoying them. Think outside the box when you do some of those things, and I love the personal experiences as well. So if you have a personal experience with a lot of you guys were talking about heat exhaustion or the absence of athletic trainers in high schools, that's fantastic stuff. So as much as you can personalize it, I think that will benefit you as an athletic trainer and definitely benefit you in this class as well. But let me know if you have any questions. If you guys want to go into anything any more in depth or further, we can do that through WebEx, or we can FaceTime, or whatever you guys want to do if you want to get some more experience. But this is the kind of stuff you're not going to get with an online course. So I wanted to make